We needed integration. We needed it yesterday. And you're going to see a ton of interest, I think, from the Biden administration to really think broadly and deeply about how do we tap our existing healthcare infrastructure, but focused on addressing inequities. That will inevitably mean new technologies to engage constituents, consumers, patients in ways that we don't today. I think that too will likely be fueled by APIs. It's fairly obvious that APIs will be a critical part of how we operate the integrated delivery systems of the future.
I think we all know that it's not only physicians who are burned out, but it's really the entire care team. It's physicians, it's nurses who are burnt out from various drivers of the time and the effort required to spend navigating EHRs. And so our approach to this, or one of our approaches to this, has been to use applications using APIs within the EHRs to assist their teams with more efficiently and effectively delivering care. So use all the information under their fingertips to not only triage clinical concerns, process information, and then deliver that care to patients. From a care team perspective, I think that's been very empowering.
Where did the regulators sort of come down? Number one, we want to move the entire medical record into an open data model as a country. And so you see that now with US CDI, we're adding notes, we're going to go further and further. Doctors now have rights to install smart on FHIR apps off of their regulated endpoints. And that is a game changer. We'll move to a collaboration model around value-based care where there's be much more open access, API-based access, and hopefully a national debate about a better way of measuring value. That's my dream for where we're heading.
Leveraging the third-party world and leveraging the FHIR-based apps to ease that integration is probably a paramount strategy to deal with a variety of stresses. Given that reality, fiscal reality, I need the ability to integrate a wide variety of third-party apps for interoperability purposes and other types of things. I need this to be done. So one way you address that demand and take some pressure off your R&D budget is to partner with third parties who can fill gaps, who can cover areas that you can't get to, or you can't get to as well as you'd like them to, et cetera. Given this value proposition, there's really utility to having a formal program to introduce this base of third-party really cool stuff to those who are delivering care on a day-to-day basis.
This has all changed really thanks to the API-based integration models that have been introduced by the EHR vendors and other digital health innovators that are really enabling a new breed of technologies that easily plug into the underlying EHR systems to provide better experiences for both providers and payers. And we're plugging in via FHIR APIs to that HIE. We're plugging into via FHIR APIs to the EHR, and we're combining all of that data at the point of care that we're synchronizing through these APIs in real time to provide a much more complete picture of that patient's medical history from across all of their encounters. I would encourage health systems to like Penn has, develop programs in order to much more rapidly deploy these technologies. You can try it out in 30 days, and so that creates the incentive to really be more innovative.